My name's Lauren, and this is my medication administration video. Check off. Okay, so the first thing that I'm going to do is I'm going to go into the medication room and I'm going to have no interruption zone. So I'm going to limit conversations with colleagues, I'm going to shut the door, and I'm going to not answer the phone. Now I'm going to compare my patient care order form to my medication administration record. So I've got patient Jaguar J. Jones, Jaguar J. Jones. Date of birth 08-25-1963, 08-25-1963. Medical record number 417-6352, 417-6352. Penicillin allergy, penicillin allergy. The right drug is Novolenor regular insulin, Novolenor regular insulin. The right dose 10 units, 10 units. Right route subcutaneous, subcutaneous. Right time 30 minutes before meals, 30 minutes before meals. The right indication for insulin is for blood sugar, and then the right documentation, all factors of a legal prescription are present. So now we are done with the patient care order form, and we're just going to use the medication administration record. So I am going to go get the correct vial and correct syringe. So I've got Jaguar J. Jones, date of birth 08-25-1963, medical record number 417-6352, penicillin allergy. Perform hand hygiene and get the right medication. I've got Novolenor regular insulin. And I got Novolenor regular insulin on the MAR. I need 10 units. This is U100, so I will draw 10 units. Right route subcutaneous. Right time 30 minutes before meals. Right indication is blood sugar, and right documentation is all factors are present. And then I've got my insulin syringe. Okay, so now I'm going to draw up the medicine. So I'm going to get an alcohol prep pad, and I'm going to clean my vial. I'm going to draw up 10 units. So here's 10 units. And I'm going to insert that into my vial. And I'm going to flip it over and draw the medication. And you don't want any air bubbles. Alright, so here's 10 units. And then for insulin, I would need to get another nurse to verify that I've got Novolenor regular insulin. Here's Novolenor regular insulin. I pulled that from this vial, and then I need 10 units, and then another nurse would verify. The right route is subcutaneous. The right time is 30 minutes before meals. The right indication is for blood sugar. The right documentation is all legal factors are present. The right patient is Jaguar J. Jones, date of birth 08-25-1963, medical record number 417-6352, and a penicillin allergy. So now I'm going to prepare a label. So on the label, I need to write the patient name, the drug name, and the dose. Jaguar Jones, Novolenor, and 10 units. And then I'm going to put that on my syringe. Okay, so now I am ready to move to the patient's room. So I'm going to take my MAR, my vial, and my syringe, and I'm going to perform hand hygiene. I'm going to identify the patient to the MAR, I've got Jaguar J. Jones, date of birth 08-25-1963, 08-25-1963, medical record number 417-6352, 417-6352, and a penicillin allergy, and then I would assess the patient for any more allergies. And now I need to complete the rest of my 7 checks. So I'm going to get the patient up to working height, raise the bed, lower the rail, and then I'm going to finish my ride. So I've got Novolin regular insulin. Here I've got Novolin regular insulin, and I pulled it from my vial Novolin regular insulin. I've got 10 units, and then I still have 10 units in here, and it's on my label, and I verified that with another nurse. The right route is subcutaneous. The right time is 30 minutes before meals. The right indication is for blood sugar, and the right documentation, all factors of a legal prescription are present. So now I'm going to put on my gloves and my goggles. And I'm going to assess the skin and muscle integrity, and then I'm just going to tell my patient what I'm doing, that I'm just about to administer their insulin. So for my pre-assessment for insulin, I would assess the patient's blood sugar, and they're good to go, and the muscle and skin integrity is good. So now I'm going to identify the injection site, which for subcutaneous preferred injection site is the abdomen. So I'm going to go 2 inches away from the umbilicus, identify the anterior superior iliac spine, and not go past that. I'm not going to go above the costal margin and not below the pubis, so that leaves me with the U shape, which is enough room for multiple injections. So we've got that injection site, and I'm going to clean the injection site. Okay, so if I can pinch 1 inch of skin, I will administer at a 45-degree angle, and if I can pinch 2 inches of skin, I will administer at a 90-degree angle. So I can pinch 2 inches, administer straight down at a 90, slowly get the medication, quickly remove, and dispose into a designated sharps container, and apply pressure but not massaging. Now I'm going to reposition the patient for comfort, discard of gloves and goggles, and then assess the patient for any allergic reactions. If they don't have any allergic reactions, then I'm good to go, and then I would come back in 30 minutes and when this patient has eaten, and then I would reassess the patient and reassess their blood sugar. And this concludes my checkoff.